Go ahead.
با درود، این برنامه رو با یاد و نام نوشین رفیعی عزیز خانم دکتر شروع میکنیم و تقدیم میشه به روان پاکش. من شهرزاد هستم، در شهریور ماه سال 1400 هستیم، 26 آگوست 2021. امروز انجمن ایرانیان آریزونا میزبان آقای دکتر عباس شفیعی هستش. سخنرانی امروز در خصوص اطلاع رسانی در مورد کلون کنسر و سلامت روده بزرگ می باشد. آقای دکتر عباس شفیعی متخصص بیماری‌های گوارشی هستند و بیشتر از 25 سال هستش که در کلرادو اسپرینگ مرکز اندوسکوپی دارند و ایشون در رشته پزشکی در سال 1988 فارغ التحصیل شدند و در نیویورک رزیدنسیشون رو انجام دادن. فلوشیپ رو در لوئیزیانا استیت یونیورسیتی انجام دادن و پست دکترالشون رو در ژاپن و چین به پایان رسوندن. ایشون همچنین متخصص بیماری‌های داخلی هستند و همینطور بیماری‌های گوارشی. در ایالت‌های کلرادو، لوئیزیانا و کانادیکت دارای مجوز پزشکی هستند. ایشون همچنین به کار تدریس مشغول بودند، جوایز بسیاری دریافت کردند و با بیمارستان‌های مختلفی همکاری کردند. عضو گروه‌ها و آکادمی‌های پزشکی متفاوتی هستند و در کارهای تحقیقاتی مختلفی هم شرکت داشتند. خوشحال هستیم که آقای دکتر امروز با ما هستند. خواهش میکنیم که آقای دکتر سخنرانیشون رو شروع کنن. سخنرانی به زبان انگلیسی خواهد بود. پرسش و پاسخ رو میتونین در چت بنویسین و 10 دقیقه آخر به سوالها پاسخ داده خواهد شد. میشه هم به فارسی باشه هم به انگلیسی. خیلی ممنون آقای دکتر، خوش آمدین، بفرمایید.
خیلی متشکرم. درود به دوستان عزیز در آریزونا و هر جا که هستین. Good evening and thank you for inviting me. Thanks to Nasser and Shahzad and the committee that asked me to spend this evening. I know Nasser for many years and my condolences to Mrs. Rafii and the family as well as to the Iranian committee in Arizona. So me and Nasser initially thought what to talk about digestive disease and as well as how to be aware of colon cancer as well as preventive disease. Initially I thought talk about overall about anatomy of the digestive system and then talk about some of the common visits that we see in our clinic, which most people probably sometimes familiar with those, such as reflux, irritable bowel syndrome, or celiac. Then majority of the time spent on colon cancer. So again, thank you for taking valuable time from your busy day and your family and joining us in here. So I will start So gastroenterology is the practice and understanding of the digestive system. The digestive system starts from oral cavity, which includes salivary gland and as well as the oral cavity for breaking down the food, down esophagus and subsequently the stomach, small intestine and large intestine. Other part that helps with digestion is the liver and pancreas. The digestive phase initially starts what we call the cephalic phase, which is when we see the food, we salivate, or when we see or we even smell the food, or even think about the food. That's where the digestion starts. In digestive tract, we have as many as neuron as we have in our central nervous system. So when we see the food, the digestion start, then as we put the food in our mouth, the salivary gland helps to lubricate with our teeth, break down the food, and subsequently the food passes through the esophagus or meri to the stomach, and in stomach where the food gets stored. During this time, the food depend on the consistency of the food and what we're eating with gastric acid as well as multiple enzymes break down the food. The stomach is the only part of the digestive system can contain acid up to pH of 2, which is very, very acidic. Subsequently, when the food is adequately prepared by the stomach, it moves to small intestine. And in small intestine, large amount of secretion from the pancreas, as well as bile, neutralize the acid and prepare the food for absorption. The small intestine is very important for secretion and absorption of the food. We can live without our esophagus, stomach, or colon, but the small intestine is the crucial for longevity as well as the liver. So after passing through the small intestine, the remaining of the food product and it will enter the colon, where the colon job is to absorb water as well as solidify the stool. The hydration is very, very important for the digestive system. And commonly, the most area that we get disease either in the stomach, where the acid, where the food get introduced, and where it reconstitutes in the colon. Small intestine is mostly neutral and very seldom get disease. Some of the common GI disease that we see in our daily practice is one, gastroesophageal reflux disease, peptic ulcer disease, stomach cancer, gallstone, malabsorption, irritable bowel syndrome, inflammatory bowel disease such as ulcerative colitis or Crohn's, and of course, colon polyp and cancer. After interviewing the patient and examining, a good clinician can tell 90% of the times that understand at least with the working diagnosis for a patient about their disease. And many times at this point, we do the investigative work, whether we need laboratory or recommendation with the diet. However, if we need further diagnosis, we can do endoscopy, upper endoscopy called EGD, colonoscopy, ERCP, which we can look through the pancreas and liver, capsule endoscopy, CT scan, ultrasound, endoscopic ultrasound for further evaluation of the disease as needed. This is a typical endoscope if you have not seen any. Usually there is a light source which connects to the scope. It is very flexible, and there's a handle, the handle which we can control the movement of the shaft of the scope. There is a port for introducing a different instrument, as well as medicine, water, as well as suctioning if you needed to. The scopes are very flexible, very easy to pass, and usually they're less than 1 centimeter in diameter. In the upper GI tract, we can examine the esophagus and the direct visualization, look for evidence of gastroesophageal reflux disease, Barrett esophagus, ulcers, stomach cancer, duodenal ulcer. This procedure is very comfortable today with sedation. Sedation can be done by different methods, but 99% of the times people, they request sedation, and it's very comfortable, and only takes about 10 to 15 minutes to do a complete exam. If we do further treatment, such as dilation or other treatment, it may take another 5 to 10 minutes. So it's very simple and easy procedure. And of course, everybody has inner beauty, and the common exam that we do these days for preventing colon cancer is a colonoscopy. During colonoscopy, patient also gets sedated, the same as with an upper GI tract. And the main important about examining the colon is adequate cleansing, which is not pleasant. So nobody likes to do the colon cleansing, but the more cleaner you are, the better accurate the result is. The colon is about 4 to 6 foot in average. We examine from the rectum, and we call retrograde. We go to all the way to the end of the colon, and during the examination, based on the patient's symptoms, or for screening, we look for colon polyp. This is an example of a polyp in here. And when we see the polyp, based on the size, based on the location, we can choose different instrument to remove the polyp. If the size was too large and to be removed to endoscopy, then we do sampling biopsy, and we send that to the pathologist. For evaluation of small intestine or esophagus, for people that have such anemia or disease that they're very difficult to diagnose by imaging, we have a capsule or pill cam. This is a very sophisticated capsule. It has camera at both ends. This excellent for small bowel and esophagus. However, it does not have adequate light at the present time for the stomach or colon. In near future, probably this will be the main examination of GI tract. And the picture from these are very high resolution and excellent. In generally, GI tract is the disease that we see in our office. 70% can be eliminated by good diet. So a healthy choice is very, very important for not only feeling good about GI tract, for preventing other diseases like coronary artery disease, diabetes, hypertension, cholesterol. So in general, I will tell my patient, you are what you eat. So it's a very, very important that we not go to crash diets or have a long plan and good habits. One of the key things, especially living in Colorado, is drinking water. So we should drink at least 72 ounces of water, or enough that during the day, keep our urine clear. If you can keep your urine clear, then there is adequate water for digestive system as well as other part of the body. A balanced diet, daily exercise, and a good night's sleep. You should never smoke and avoid drugs, as well as to know that the processed food and fast food are the killer of this country at present times. Fast food, fast life. And more importantly, learn to cook. There's nothing better than food come from your own kitchen, because the food outside, they always have additive and preservative. Just a successful diet, it is not really, as anything else, is not a destination. It is a journey. So we have to work hard, develop good habits, and it's a long life. The more you take care of yourself, the less you spend time in doctor's office. This is a typical patient these days we see in the office. I do not need even do any endoscopy or any do labs. I can assume, or at least I can presume what a disease that he has. Most likely he has sleep apnea, he has gastroesophageal reflux disease, has fatty liver or metabolic syndrome, pre-diabetic or soon be diabetic, hypercholesterolemia, hypertension, constipation, bloat, and eventually he will have heart disease and stroke. Today, we have more knowledge about diet, but unfortunately, we are, with all the knowledge that we have, we do not take care of ourselves well. We become a very fast food nation, and it's going to be detrimental to all of us, as well as the health business of the future in America. One of the common things we see is gastroesophageal reflux disease. The symptom of gastroesophageal reflux, when the gastric content refluxes to esophagus or beyond the esophagus, sometimes to our oral cavity, larynx, lungs, and at least 20% of the Western population experience reflux weekly. We only see the tip of the icebergs. We see about 6% of this population in our office. So majority self-medicate or they ignore their symptoms. And reflux, I tell my patient, listen to your body. The body it communicates you very well. When you have reflux, imagine you're driving a car and you're looking at your dashboard. If the red lights give you, it means you're eating too much, too late, or the wrong food. So these are the warning. Taking a pill and make the symptoms go away, the consequence of this eventually will become in metabolic syndrome and heart disease. So normally our esophagus or mary meets under the diaphragm to our stomach, and there is a sphincter called lower esophageal sphincter, prevent from acid reflux into our esophagus. And some people, they have what they call hiatal hernia. Through the diaphragm, the stomach will herniate or slides up, and at this point, the lower esophageal sphincter is not as functioning as before. So if you eat many spicy food or eat too much, then the consequence you get reflux, and the warning is a heartburn. Commonly, you should not eat more than 1/3 of your stomach with food, because whatever you put on the table, including appetizer, main course, or dessert, within 45 minutes doubles in the size. And you need to have 1/3 of your stomach for contractibility. So if you eat until you're full, you're past halfway. Within 45 minutes, your stomach's completed with juice and food. Then as soon as the contraction takes place, then you're gonna consider reflux. Some of the indication that majority of the reflux we treat with dietary. 80% you can really be controlled by a modification of diet and appropriate medication. There's certain signs that you should need further evaluation because it can cause esophageal cancer. One, if you have difficulty swallowing, if you're losing weight, these are the alarming symptoms. If you have symptoms regardless of taking medicine and using dietary precaution. After 5 years of consequence reflux, the lining of the esophagus will change to something called Barrett's, and this is a precancerous condition. Commonly is people over age 50 or had reflux more than 5 years, and commonly obese, and is very common in white male, but can happen to any cultures. When we do endoscopy, this is the looks of hiatal hernia. As you see the above that is inflammation called esophagitis, and the esophagus is not accepted by acid. When acid or inflammation is there, then we will feel the discomfort, then heartburn, indigestion. Some of the trigger food is the food volume. Even if you eat very healthy, if you eat too much, you're gonna reflux. Eating late at night, within 4 hours going to bed. Excess of spicy food, tobacco, alcohol, food containing acid and severe acidity like tomato paste or citrus juices, excess of caffeine, fatty meals, chocolate, strong peppermint, as well as some of the medication. The combination of these will affect the lower esophageal sphincter and causes acid reflux. The management, besides lifestyle modification, there are medications like an H2 blocker, like Pepcid and other medication. PPI is like Nexium, which everybody, a lot of you are familiar with, other medication. And there's also surgical correction for extreme cases. Unfortunately, the surgery is very complicated, and majority of the people will undo the surgery within 3 to 5 years. So, and another complication of that, when you have a fundoplication, you cannot have nausea or vomiting, and you're gonna have upper abdominal discomfort in most cases, but not all. Another disease we see commonly in our office is irritable bowel syndrome. In general, I'll tell people the GI symptoms or GI pains divided in 3 groups by my understanding. One are the structural disease, the one that we see ulcers, hiatal hernia, polyps, cancers. Those are easy, can be diagnosed and treated. However, majority of the symptoms that we see, they are the non-structural disease. It means there is no structural abnormality. Imagine that if you have a Charlie horse or leg cramps, when you have the leg cramps, the pain could be 10 out of 10, and you go to emergency room, they can do CAT scan, MRI, other imaging study, and they find out it's all normal. The pain that you're feeling is true, but the There's no structural abnormality, and you cannot treat this with surgery or other modality. The same thing happened with this abdominal cramps. And there's many names for irritable bowel: visceral sensitivity, nervous colitis, functional bowel disorder. It is a very common, it's one of the common visit to the doctor's office. In United States, mostly female. However, the India, Sri Lanka is mostly male. The symptoms can be vary from person to person, from gas, bloat, cramps, diarrhea, constipation. It is one of the number one cause of not going to work or children not going to school. Majority of the patient can be educated and get better with lifestyle modification. However, some they need counseling and medication. Other disease that we see, which is today gluten-free diet becomes very common and in vogue, is celiac sprue, which is sensitivity to gluten, which is in barley, rye, and wheat. Only 1% of American population have true celiac sprue disease. However, there are 25% are on gluten-free diet. And many of the people, they think gluten-free diet is a very healthy diet. However, if you compare a loaf of gluten-free bread to a sourdough or other well-made bread, possibly the gluten-free diet, gluten-free bread is more harmful to you than if you're not celiac sprue. If you have celiac sprue, of course, even a small contamination can cause inflammation. And majority of people these are gluten intolerance, but if you eat excess of gluten, particularly with milk, you can get gas and bloat. Anybody eat grape nuts with milk, they're gonna get gassy. That's a part of the digestion. But however, many people, they go on gluten-free diet and they think gluten-free cookies, bars, all they're healthy. They still have calorie, they still have other processing in it. So choose wisely, and they're very expensive. In general, the celiac, the symptom celiac disease can be very, majority of people may have no symptoms. However, the abdominal pain, bloat, most of the time we get patients from dermatologists because of the rash. Some they come from anemia, failure to thrive, and severe cases, and sometimes they can have mouth ulcers. It is an inflammatory response in the small intestine, particularly in upper GI tract, to gluten. When you eat gluten in this patient, body recognizes it as a foreign enemy. And as soon as get over there, the immune response start fighting this gluten, this molecule. In consequence of this inflammation, the lining of the small intestine will slough off, then consequently malabsorption is an autoimmune disorder, which is common in wheat, barley, and rye. How to treat it is very easy. You go on, the treatment is that you do blood test or you do small bowel biopsy or genetics. However, if you're on gluten-free diet, some of these tests can be negative. The treatment is just avoiding gluten. Unfortunately, gluten today is many food because it's the best friend of chef, as well as make all the food taste good. So in canned food, salad dressing, candy bars, instant coffee, meats, many of them, they include, they have gluten in it. So if you have celiac, you have to be very carefully, and rarely needs medicine. So from now on, I'm going to go to the main topic, which is colon cancer. Colon cancer is the second leading cause of death in the United States. In 2019 alone, the case over 51,000, that should be 51,000 cases diagnosed in the United States, and approximate death in the United States, and approximately each year, more than 140,000 cases get diagnosed annually. And presently, we have over 1 million survivors of the colon cancer. There's a misnomer, this happens more in male than female. On average, 1 out of 20 male and 1 out of 20 female, they will be diagnosed with colon cancer. Majority of these people, when 90% are above age 50, is a very common above age 60, common between 40 to 60, and rarely is below age 40. Among ethnic group, unfortunately, African American are the highest incidence of colon cancer, but this happens to almost most population, and I'll go to that later on. The large intestine is the same name as colon, which is the last portion of the GI tract. Because the stool will accumulate there, and all the dietary intake we do reaccumulated, it causes the macroinflammation, and with some genetic predisposition causes colon polyp and consequently colon cancer. Initially, we thought the colon cancer mostly is in the left side because that's where you have the most symptoms. However, colon cancer be 33% in the right colon, which called ascending colon, 13% transverse colon. In the left colon is 54%. The colon cancer that is in the right side almost very seldom has any symptoms. The reason is that because number one, the diameter of the right colon is very large, and even in bleeds, it mixed with stool and we do not have the symptoms. The symptoms that you read on the book or media is mostly showing in the left colon and rectum, thinning of the stool, blockage, discomfort, all of those things, mostly the sign of the left side of colon cancer. Unfortunately, majority of colon cancer are sporadic, so we cannot predict who has it. However, there's a subclass family, and there's some genetic disorders such as Lynch syndrome. These are the smaller portion of the colon cancer, so majority are sporadic. This is a small slide, but this mostly shows the distribution throughout the world. Australia, Europe, North America, they are the most common. In sub-Saharan Africa and in Asia, they're less. However, in Asia, such as Korean, they have still high risk of colon cancer. The death rate among the colon cancer above 50 has decreased. However, now we see the increased colon cancer for people in age below 50. And for past few years, many societies have recommended that we should be screened at age 45 because between age 45 and 50, we miss many people. And by the time they present, they are stage 3 or 4. The colon cancer and colon polyp in early stage has very rare symptoms. Fortunately, colon cancer can be prevented by early diagnosis. In many cases, if the patient is well educated and they watch their diet and do early screening, this can be prevented and can be cured. The late symptoms of colon cancer include abdominal pain, change in bowel habit, bloody stool or dark stool, anemia, weight loss, sometimes spread to other organs before we can have any symptoms, fever, and sometimes bacteremia in rare cases, but these are very late stages. When we look at the colon, the normal colon, it causes absorption of the water and it's the stool. If we have any pre-genetic disposition or we have mucosa at risk with inflammation, certain processed food, red meat, and many we do not know, causes polyp formation. And the polyp come in different form. As you see in the picture, the polyp at this stage we can remove through endoscopy, and that's what screening is mostly. If we do not remove that, eventually will turn to colon cancer. From a small polyp to become cancer, it takes 7 to 10 years on average individual in sporadic types. If you have Lynch syndrome, this process can be only 35 months. The exact cause of colon cancer is really unknown. However, there's certain risks that can increase developing colon cancer. As I mentioned, majority of colon cancers start with a small polyp, but not all. Some other form of cancer, it can be in the wall or can be from other diseases like inflammatory bowel disease and can be microscopically. We think a local inflammation due to microbial in the gut from red meat and diet that is rich in fat, processed food, may be a contributing factor. What are the risk factors? Number one, old age. We cannot shake our genetic, and we cannot stop advancing age. So those are the two biggest factors. So as we get older, we need to be more cautious of the disease. The other one is African-American heritage, personal history of colon cancer or polyp, family history of colon cancer, disease such inflammatory bowel disease such ulcerative colitis and Crohn's, radiation to the abdomen, obesity, diabetes, sedentary lifestyle, as they call it, couch potatoes, high fat, high fat diet and low fiber, smoking, and excess of alcohol use. When a person asks for screening, we divide them in two different groups. And that's very simple. You can look at yourself, whether you're high risk group or whether you're average group. And that makes your choice of testing very easy. Majority of primary care physicians, sometimes they do not understand that, and they do many tests which are inappropriate for the right group. So high risk group and average risk groups. Who are the high risk groups? Number one, people that have colon cancer or polyps in the past. Many people that think that they have colon cancer and got treated, they're not going to get colon cancer. I've seen 3 times people getting colon cancer because they did not follow the protocol. So it's very important. If you had polyps in the past, follow the recommendation, or had colon cancer, so you do not get more cancer. Family history of colon cancer, inflammatory bowel disease, people known with inherited disease, as much as Lynch syndrome, people have radiation to the abdomen. In family history of colon cancer, the younger age in the family, the more genetic it is. So people that they have family history of colon cancer below age 60, they should be screened at age 40. If anybody aged below 50 on, then 10 years before the person was diagnosed, as I mentioned before, it takes 7 to 10 years to develop from a polyp to cancer. So if somebody is diagnosed colon cancer at age 45, the sibling and children should be screened at age 35. If somebody was diagnosed at age 38, the family should be screened at 28. So the high risk group, the examination is straightforward, is the colonoscopy, because you need to look at small polyps, remove them, or have the direct visualization. These are high risk groups. If you are a healthy individual and you have what they call average risk, meaning you have no symptoms, you have no family history, and you have all healthy, and you're at age 45, then you have choices. You can do colonoscopy, you can do called virtual colonoscopy or computed colonography. You can do flexible sigmoidoscopy, you can do stool testing, but FIT or a cold blood or Cologuard. All of these, they have their own pros and cons. You can talk to your primary care to choose the right appropriate thing for the right setting. Some places they do not have colonoscopy. Some places they do not have virtual colonoscopy. And some people, they're only available flexible sigmoidoscopy. Flexible sigmoidoscopy is like colonoscopy, but only shows the last 1/3 of the colon, so you can miss the proximal lesion. And the stool testing, they are better than nothing. However, they can have a false positive and false negative. When you go to get a colonoscopy, then if there's a polyp, the physician or gastroenterologist will recommend follow-up. The follow-up is mostly based on the size and the number of the polyp. If there are none, then you can have it 8 to 10 years. If they're very small polyp and they're hyperplastic, which means no inflammation, it can still go to 10 years. If they're 1 to 2, they're less than 10 centimeters, based on the location and cleansing of the colon, 5 to 10 years, and so on and so forth. If they're very large, more than 1.5, then you may have to repeat it 6 months. If they have a high-grade dysplasia, 3 years, I'm sorry. So this will, with consultation with gastroenterology, make that decision. Not only the size of the polyp, how clean you are, and how difficult the colonoscopy. People that had abdominal surgery, like hysterectomy or other surgeries, or they had gastric bypass, sometimes the examination is difficult. So that will increase the frequency, so you don't miss certain polyps on the certain side. So the Cologuard, which is becoming a very popular test, we have a lot of headaches with it. On the advertisement, one, it costs about $800 per exam. In advertisement, this is can pick up colon cancer 92%, and other, as you see the data here. However, in our practice, as well as in Mayo Clinic studies, it shows more than 30% false positive. And there is not exactly has worked out how to follow up this false positive. As a clinician, you always feel and study whether you miss something. So we examine twice or 3 times the colon, make sure there's nothing missed. Then for the patient, they're always worried, was there something missed? How to follow up? Should I go to there? So this test, one is expensive, one is has a lot more false positive that the company make it to be. So you need to make sure, talk to your physician for appropriate testing for yourself. When you hear that somebody has colon cancer, it doesn't mean that death is right around the corner. So if it's stage 0, chance of survival for 5 years is 100%. If it's stage 1, is 85 to 95%. If it's stage 2, 72 to 83%. Stage 3, 44 to 83. Unfortunately, when it gets stage 4, is less than 8%. So the early diagnosis, the better longevity. That's why we have over 1 million survival. If you had colon cancer was resected, you need to follow an examination 1 year. Then if it's normal 3 years, then every 5 years after that. So prevent from secondary colon cancer. So in summary, colon cancer is a very common. Colon polyp and early cancer have very little symptoms. Early detection is the key time to survival. Fortunately, colorectal cancer can be prevented by patient education, good diet, good lifestyle modification, and early screening. I recommend as a general diet to my patient, if you want to stay healthy, not only for colon cancer, for all purposes, longevity, number 1, drink plenty of water, about 72 ounces of water. Your diet should be 80% plant-based, 10-15% chicken and fish, and processed food and red meat and other things less than 5%. The less of that, the less chance of colon cancer and longevity. And another important thing is not eating late at night. So try good breakfast, good lunch, light dinner. Always take time for exercise. You should exercise at least half an hour a day, regardless of what type of job you do, at least half an hour. And should do about another half an hour stretching when you get up in the morning for 15 minutes and before you go to bed. That's a formula for just basic diet for longevity that I recommend to my patient. The more home cooking, the less GI tract. I said the more time you spend in your kitchen, the less in doctor's visit. I was doing a mission in Philippines. You never know where you get a really good advice. About 4:35 o'clock in the morning, I was going for a walk. I come on this health spa, and this was a beautiful sun. Body tells me, you ignore me now, but you need me later. And through all my education, 28 years of education, 25 years plus practice, I have found out my grandmother knew more about digestion and preventive disease than many of my well-educated patients. So be wise, choose wisely. You don't have to have fancy education for preventive disease. It's just, habits, and pick up a good habits. At this point, I'll stop my speech, and then we'll open to conversation. And if you have any question, we'd be glad to entertain. I hope this was informative and was not too much information for everybody.
خیلی ممنون، عالی بود آقای دکتر، خیلی اطلاعاتون رو زیاد کردین. من اینجا سوالی نمیبینم، نمیدونم از طرف فیسبوک منتظرم ببینم سوالی میاد یا نه. البته دوستان هستن روی خط ولی من فعلا هنوز سوالی نمیبینم. حالا منتظر میشم ببینم از طرف فیسبوک سوالی میاد، دوستان سوالی دارن یا نه. یه سوال میبینم. سوال اومده که آیا شما سبزیجات مخصوصی پیشنهاد میکنین که for better to cleansing your digestive tract? Are there particular veggies that are better for cleansing your digestive tract? سبزیجاتی هستن که بهتر تمیز میکنن.
Yes and no, but in general, if you look at the old Persian diet, sabzi khordan, the sabzi that we eat with noon sabzi, this is one of the best fiber for increasing the good microbial in your gut. The smaller the leaf it is, the easier to digest. So in general, fruits, particularly berries, they do not produce gas. The question about the fiber is whether it's soluble or insoluble. And one of the things, if you eat lots of fiber, you produce gas and bloat, and people feel very uncomfortable. So you need to choose your fiber wisely. Commonly, fruits, particularly berries, they do not produce gas. However, the skin of a peach or the skin of an apple, which is non-soluble, can cause cramping and gas. In the other type of fibers, when you cook, in our digestive system, we do not have an enzyme to break down the fiber. So how you prepare it, the more you chew it, the smaller the leaf, the easier to digest. If you look at the ancient culture, like Indian diet, which is vegetarian, they do not eat too much raw vegetable as we do in West. They always cook the vegetable very well, and they introduce it to the right, like turmeric, ginger, other type of things to break down the fiber. So when you digest it, you can benefit from more. So if you eat lots of cauliflower or lots of broccoli, which are very good for you raw, then consequently you're going to get gas and bloat, and that causes other issues. So you choose balanced fiber. Commonly tropical fruits, they do not produce gas. However, things like cabbage or very tough vegetable, they produce more gas. So you have to be balancing it out throughout the day. I always recommend at least have 2 fruits a day as well as 1 salad a day. So in the morning, berries or any fruit, citrus fruits. The juices that the people consume has too much sugar, has too much metals in it. So it's best prepared that a good seasonal fruit, and you have to enjoy the meal. You have to enjoy that something that's seasonally that is available. One of the things we see today, availability all the grocery store, we eat the same food over and over. If you look at the ancient culture or the people that live in the blue zones, they will eat seasonally. What they eat in summer, they do not eat in winter. So get the cleansing of the bowel, and they eat meat, for example, in the winter there. Most of the summer, they eat fruit and fiber. So you have to be wise. So benefit versus the side effect.
Okay. خیلی ممنون. The second question is squanting method for going to the bathroom helpful or hurtful for the colon health?
Well, this is a good question. For emptying of the colon, of course, squatting is the best thing to do. However, as we age, the arthritis and our body shape will prevent us from squatting more. When I was a child back home, of course, squatting is easy. It's very easy to align the colon with the rectum and have a quick bowel movement. However, as you get older, sometimes it's difficult. So you have to see risk benefit. However, but overall, yes, squatting is easier way to evacuate the colon. But however, if you have adequate water and adequate fiber, and the best time to have a bowel movement in all the animal kingdom, except human, they don't do it. You should always start your diet with 2 glasses of water, eat a balanced meal. With 10-15 minutes after each meal, you should go to the bathroom. That's a healthy way. All animal kingdom you do. If you live in a farm, you feed the cow, they have a bowel movement. If you have a cat, the same thing does. So this is a good way that's how your colon is ready to have an evacuation, 10-15 minutes after each meal. So if you subside that for many years, then that reflexes goes away. So So you want to have a healthy bowel movement is the best thing to do. Even if you don't have a bowel movement, release of the pressure from the colon, especially if you eat a lot of fiber, that prevent from diverticular disease and gas and bloat. So get a good habit of 15, 20 minutes after each meal, go to the bathroom.
Why is red meat so bad and yet humans have evolved hunting and eating red meat?
Red meat is a balanced red meat. There's not, I just had a study read it this week about, for the first time, to see why the red meat is causing many diseases. The exact causes we do not know, tell you the truth. However, today's red meat is a processed red meat. They feed the animal many antibiotics, they give a lot of hormones, and consequently, when you eat animal protein, it slows down the movement of the colon. Then consequently, people that eat too much red meat, they're constipated. And when the longer the stool contact with the wall, and then consequently, more chance of cancer. And the red meat, fatty meals, and processed food will prevent from growth of good bacteria. If we look at the ancient eating sabzi, eating turshi, eating let's say 80% plant-based, or eating yogurt, this adds to good bacteria in the colon, and that's prevented from disease, colon cancer. However, the red meat, fatty meals slow down that process, and the ratio of the good bacteria to the bad bacteria will decrease, and then consequently you get colon cancer, colon polyp, diverticulosis, plus other disease.
Okay, thank you. Next question, are dairy products bad for digestive system?
Dairy product is depend where they come from. If you look at the ancient cultures, they have mostly goat and sheep milks, which has many lactate. So those are easy for us to digest. Cow milks require a lot of enzyme to break down, then consequently they cause gas and bloat. However, through the time, the fermentation to cheese and yogurt has made those are much more digestible. For example, yogurt has many lactobacillus, and is good quality cheeses. In general, if you look at animal kingdom, past 6 months, no animal will drink milk from another animal except human. Human are the only species that we have borrow milk from other animals to use for our digestion through the time. So in general, if you have to choose a dairy, a goat cheese or sheep cheese is like feta cheese is better than, because if you choose cow, yogurt and cheese is better. I do not recommend cow milks to most of my patients because most of them have irritable bowel syndrome, gas and bloat. And so in general, if you want to have it pure, not to have it, that's okay. But a good quality yogurt, it may add to good bacteria in your bowel. So it's a balance act. So in general, it's depend on the sensitivity. People that says people are lactose intolerance, but we are all lactose intolerant. Some people has developed through the time developing to lactate, and through the time again with goat and milk we have adopted more because it does not need as much enzymes. However, for example, Indian, Native American, or a Chinese, if you give them a glass of milk, which has not lived in the cities, within half an hour to an hour, he's going to end up in the emergency room. So it's an adaptation of the lactate through the time that make us to be able to digest it.
Okay, thank you. This one is a comment. She says, in ancient eating ways, red meat was not always available and we did not eat a lot of it. Correct.
The red meat, if you look at majority of the cultures, it was eaten of course, in the harsher times of the year, mostly in fall and winter. The diet also have to be with location and what you're doing. And if you're an office worker, your diet completely should be different than a farmer, because what you do. Today's office work is harmful to your body as smoking cigarettes. But at the same time, I was lucky to be in 2002. We went with family to Tibet, and one of the interesting, we went to a monastery and was lucky enough to go to, when I go places, I want to see their kitchen to see what they eat. When I entered the monk's kitchen, there was a mountain of butter and yak meat. I was shocked, and they're all skinny and they hardly have any cardiovascular disease, eating that much fat and that. When I talked to some of them, this is why, I thought most of the Buddhist people, they're vegetarian. When I asked them, it says, if you're vegetarian, you cannot survive in this high mountain. So depend where your location is and what you're doing. Yes, because the fat and the red meat produces many calories. So during winter times, or if you live very high altitude, it can be not much harmful for you. It could be, cause of survival. But today's red meat has lots of processing. It has a lot of taste enhancing. When a child goes to McDonald's and loves that McDonald's, it's not lacking the meat. It's like the chemical that they induce that. Or a soda, the same things. You can make the same hamburger much healthier at home. You may have some of it, but it's not as good as that. So these are this additive and preservative and all of that. But if you look at through human history, our brain is 90% cholesterol. So when we become smarter like that, when we find out the animal protein, yes, small amount of it is okay, but too much of it is not. Then you have to look where your meat come from. In general, you need to be wise. In general, the best diet probably is the Mediterranean diet with fish, and then chicken and poultry depend where you get it. Of course, if you get it from the games outside, they have less chemical. Then usually lamb and goat, they're more sophisticated. They do not eat all the feces or other type of things. So they're very selective what they eat. Then as you go to cow, the diet is more diverse. One reason most culture, they do not eat pork, because the pork eats anything, consequence of what they eat and how their comes to their meat, and then we consume that. Of course, the more fat, the taste is in sugar, salt, and fat, and that's in every cooked shaker. So of course, those are the taste that we eat based on the taste. So you have to be reasonable. So you have to be not go only after taste. You have to go for a balanced food. So that's a sort of historical perspective that I can have come across about that. That exact cause I really do not know anybody knows.
Thank you. The next question is, did you say that colonoscopy is harder with people who have had abdominal surgery like hysterectomy, and why?
Because in general, when we do colonoscopy, it is a little, for us, technically more difficult in female than male, because the pelvic cavity that we have to pass through in male is only bladder and rectum. In female is uterus, is ovaries, is bladder and rectum. Through the years of ovulation, the scarring develop in that. So as you go, it takes a little more technically there. And when people have surgery, the GI tract has a lining outside called serosa. When you pass through each other like snake or worm, so it does not get attached to each other. But once you have bleeding or you have surgery or any insult, trauma to abdomen, then the bowel gets stuck together, called adhesion. And the adhesion make the endoscopy go through it somewhat more difficult. It's not impossible. So we use mostly pediatric scope for female, which is much more easier to do. And of course, have to do with techniques. I mean, the experience of gastroenterologists. So it's a little technically more challenged, but it's not excessive difficult. But you have to choose your instrument appropriately.
Next question, is all the hype about probiotic in form of pills accurate?
I would not take any probiotics in form of pills. And the reason is, yes, we were very excited initially when they come. Number one, it's very expensive. If you want to watch the truth, watch a program in 60 minutes, it give you a good detail of it. the bacteria in your colon are very difficult than what those they put in pills. Majority of the pills, by the time you take them, those bacteria is dead. For a while, anybody who was getting antibiotics, will give him probiotics to replenish the bowel flora. But we found that this bacteria is different than our normal flora. So for that reason, it can prevent from your good bacteria to grow. The best thing to do for your healthy colon, number one, make sure you drink plenty of water. Number two, eat vegetable, at least 2 fruits. The sabzi that we eat in our culture, which mostly in American people, they do not eat, is one of the best probiotic. Torshi, nuts, all of those, the healthy, these are all what your bacteria in the colon needs, and the ratio changes. The worst thing for them is, of course, antibiotics, soda, particularly diet soda, and processed food, and fast food. The fast food, particularly, for example, if you eat a diet soda or saccharin, that is like poison for bacteria in your colon. The ratio will quickly change. So the bacteria in the colon needs what you're eating to replenish. So that's why this probiotic they sell outside is 52 billion industry, and the person that now today they put in dog food and children food and all of that, he said, well, it doesn't cause harm. Of course, it doesn't cause harm. That makes a lot of people rich. But in general, today's data does not show that probiotics and any health. I've done many studies on blue zone or 90s and above. They find out that people they eat within 9 miles of their radius, they have the healthiest bacteria than people that take probiotic and other things. And the vitamins, the same things. If you have an intact gut, it means you have not had surgery, no gallbladder, or you don't have celiac, you don't have ulcerative Crohn's. You don't need much. Your diet will, your GI tract is very, very smart. You will choose how much to take, how you take it. If you're, of course, female have menstrual cycle, then of course you need more iron. If you're vitamin D deficient, you supplement it. If you have celiac disease, then we give you chewable vitamins. If you have bowel resection, yes, we supplement with vitamins. If you have gastric bypass, you need supplement. But in general, people overdose too much on these vitamins, and majority of the time they do not have no benefit. They make them look pretty, they look good. By the time they break down, they're halfway through your small intestine, and by the time you get to the colon, there's no benefit to it. So instead of spending time on probiotic or vitamins, spend on a good grocery, cook, eat, enjoy a good meal, then spending money in that. And we have many people with irritable bowel syndrome. They take bags of probiotics, they take bags of vitamins, they think this is there, they read some journal, an actress did cleansing, did better. Those are mostly a spastic disease, and there's, yes, even I give them sugar pills, they feel better. So in general, unless you have vitamin deficiency or you have segmental resection your bowel, depend what part it is, usually you do not need any probiotic, in my opinion.
Another question, some dietitians recommend not mixing food that requires different time to digest. For example, avoid eating fruits with protein or carb. What do you think about this? And then he also wrote along the same line, some suggest avoiding water immediately after consuming solid food.
So the water, I think, in my opinion, should drink 2 glasses of water before, about 15 to 10 or half an hour before each. The reason that one, hydrates your GI system and your body. Second, dilute the acid and prepare your stomach for getting solid meals. When you eat the solid meals, as I mentioned, it will not leave your stomach to the small intestine until it's liquefied. So your body has to work 10 times harder, produce that juice, produce that sort of water type of content, so that consequently you feel more bloated or that. The reason I say do not drink much water after the meals, because what they call dumping syndrome. If you have eat too much solid food and you water, then the water after that is swells and food get pushed to small intestine, and that's how you get cramping. People that have what they call pylorus, the small intestine, the beginning, the end of the stomach that start to the small intestine, if they have any abnormality or they had surgery, if they drink too much water afterwards, immediately they get what they call dumping syndrome. They get palpitation, they feel fatigue, they feel like lethargy. So that's the reason not to drink water after the meals. But per se is the volume of the food is important. Mixing the food, it's, there's many theories, but in general, I believe that you have to drink water and you have to have a balanced breakfast. I will have the fruits as a snack at 10 o'clock in the morning and 4 o'clock in the afternoon, or with nuts. And the diet have to be, and the table should be balanced. Overeating of anything, it causes acid reflux and discomfort. If you're feeling uncomfortable after the meals, you have to look what you ate, whether it was fatty meals, whether it was too big, or whether you eat a sort of the food that causes reflux, too much tomato base or things. So if you spread it out during the day, I think it's much wiser there. I think you should, when you get up in the morning, drink 2 glasses of water, do some stretching, sit down. The breakfast, I think, is the key nutrition of the day for bodies. Just like taking your car on the highway, you need there, and eat a balanced breakfast, either something with protein, good oil, and some fruit, I think, in the morning, like blueberries or cantaloupe or something like that, because that gives you a slow release of everything that we eat will turn to glucose, and glucose goes up, as goes your insulin. When you eat a candy bar, or if you eat a donut, or if you eat a cereal with milks, your sugar quickly goes up, then your insulin goes up. But this process with the sugar comes quickly down, then your insulin stays there, then you're craving food, then you're gonna end up snacking in the office. Again, carbohydrates, stuff like that. That's how people they gain weight. So for breakfast, a nice bowl of oatmeal with nuts and berries, a nice avocado with some eggs, an omelet. I think those are, cream of rice. But I think a small amount of fruits in the morning, I think, is a key thing with hydration in the morning. And I think that key nutrition. And the best thing you can do for your health, if you want to lose weight, don't eat big dinner and do not eat 4 hours before you're going to bed. One of the biggest study present with, I believe, Vanderbilt and NIH, people that are diabetic, hypertension, they go fasting after 2 p.m. And majority of them so far has lost weight, they sleep better, they become non-diabetic, and the blood pressure comes down. So it's the dinner that mostly since World War II, since industrialization, they work very, very hard and come home, eat a big meal, and then lay down. That causes fermentation in the stomach, initially give you reflux, and subsequently when you're asleep, it's a type of like hibernation at night. Your body temperature comes down, your mind relaxes, your REM sleep, and also digestive system wants to relax. So when you're eating big at night, you're not sleeping, your acid comes up, and when it gets absorbed, doesn't know what to do, then you get fatty liver, then you get diabetes, and when after many years, especially in your vessels, you get hypertension, and then it comes with heart disease and stroke, which is heart disease #1 cause of death in the United States.
Next question, how about pasta and rice in your diet?
Depend on the culture. Depend on the culture and where's your rice or pasta come from. If you look at the ancient grains from Middle East or Europe compared to grains that in the United States, the starch in that completely different. So the starches is the poorest man filling the stomach of the children. So it's easy thing to prevent for children getting hungry. So not everybody can. Usually through the history, meat and other type of things were very expensive. So a starch was a complementary things to fill the stomach and make children through the famine. Not only this past 40, 50 years that we have excess of food. Before there was a limited amount of food to eat. So in general, most cultures in the world, they eat rice because it's the most simplest starch, does not have no gluten, and is very, very easy to absorb. Excess of rice get absorbed faster, then of course your sugar goes up. So wild rice is a better choice, and small portion. And again, today's some of this modified rice, they have too much starch. So those are the things you have to choose. Pasta, if you look at the pasta, again, it depends what type of grain it is made of. And sometimes the less you cook it, like for example, al dente, it stays in your stomach longer, so then consequently it does not go to small intestine to get absorbed. That's why people, they recommend balgur or other things. So it's really a choice of balanced meal. I mean, of course, excess of anything is not good. I hope I answered the question.
Thank you. I don't see any more questions. I see thank yous to you, and I see thank you from Dr. Reza. Thank you very much, Dr. Shafii, for your time, for very informative presentation.
You're very welcome. I hope it was informative and learn a few things. If anybody has further question, they can give it to you guys or Nasser, and email. I'll be glad to answer them. Again, thanks to you, thanks to Nasser, thanks to Reza, as well as my condolences to Rafii family for their loss, and wish you all a happy future and healthy life.
خیلی ممنون آقای دکتر. چند کلمه در مورد انجمن ایرانیان آریزونا. برای اطلاع رسانی برنامه‌های ما هنوز دایر هستش. بیشتر برنامه‌ها هنوز آنلاین هستش و روی فیسبوک و از طریق ایمیل و وبسایتمون اعلام میشه براتون، به جز فامیلی فاندی که فعلا ماهی یک بار به صورت غیر آنلاین به صورت عمومی انجام میشه و برای مکان بعدی هم در حال مذاکره هستیم که امیدواریم به زودی مکان بعدی خانه ایران آماده بشه و برای اون هم به حمایت شما احتیاج داریم و در اکتبر هم جشن گالا رو خواهیم داشت که اطلاعاتش روی فیسبوک موجود هست. بازم از آقای دکتر متشکر هستیم. خیلی سخنرانی خوب و اطلاعات خیلی خوبی داشتیم. خیلی ممنون. دوستان اگه سوالات بیشتری داشتین میتونین با ما تماس بگیرین و ما با آقای دکتر ایمیل میکنیم و سوالاتتون میپرسیم. خیلی ممنون آقای دکتر، از منم تشکر کردن. خیلی ممنون و دیگه سوال دیگه نیستش. روز و شبتون خوش. خدا نگهدار.
شبتون بخیر.
خدا.